Welcome to my public awareness talk series. This time, in connection with Mental Health Awareness Program, which is celebrated all over the world in the month of May, I am delighted to talk on the importance of mental health in pregnancy, as mental health of a pregnant lady can highly influence the quality of the baby and hence the quality of next generation. Mental health during pregnancy should bloom like a lotus in the midst of all the challenges, because in pregnancy you are not just one but two. Pregnancy is a unique status given exclusively to women by Almighty. Although pregnancy is considered to be happy and exciting time, not every woman feels this way. In reality, pregnancy brings mixed feelings, both good and bad, due to changes associated with pregnancy. The fundamental factor for pregnancy changes, especially the emotional changes, includes hormonal factors such as increase in the production of progesterone, estrogen, prolactin, which have an impact on emotions and brain's ability to monitor these emotions. Thus, if you are little bit worried during pregnancy, you are not the only one. Remember, worry is quite common, especially during first pregnancy, and especially if it is unplanned, and it may be related to change in your role, that is becoming mother, change in your body shape, change in relationships, fear of whether you will be a good parent, fear of problems with pregnancy or with a baby, fear of childbirth, fear of work-home balance, financial insecurity, or lack of support. All these worries may fade off gradually under normal circumstances with good support, understanding, acceptance, and self-encouragement. Best way to come out of this worrisome feeling is to keep thinking of n number of successful mothers as role models who have celebrated their pregnancy, childbirth, and motherhood. It may be your own mother or friend or other family members or any celebrities. In reality, nobody is exempted from some degree of mood swings during pregnancy. Winners are those who knows how to handle mood swings. However, accelerated or constant worry state during pregnancy has repercussions on pregnant women's physical, mental health, including the little baby growing inside the womb. Because in pregnancy, whatever expecting mother thinks or feels or does, whether good or bad, has a buy one get one offer. That means both mother and baby gets affected. So, maintaining mental health is very important, starting from pre-pregnancy state, throughout pregnancy to post-pregnancy state, so as to generate a healthy next generation progeny, which is our responsibility and duty, and more than anything, remember, you have been chosen to do that by Almighty. Mental health refers to emotional, psychological, and social well-being, and it determines how we think, how we feel, and how we act, how we handle stress, how we relate to others, and how we make choices to make life happier and healthier. Mental health awareness is essential to understand the symptoms of different mental illness and to find treatment to make life happier and healthier. Every year, May month is celebrated as Mental Health Awareness Month all over the world, including India, as our mind matters a lot. This initiative was launched in US in 1949 so as to ensure that mental health is a global issue and not a social taboo. The purpose is to raise the awareness and educate the public about mental health conditions as well as mental illnesses and the reality of living with these conditions and strategies for attaining mental health and wellness, apart from eliminating the stigma or myths that surrounds mental illness. Because mental health is an incredibly important part of overall health. Currently, it is a need of the hour, especially after COVID pandemic. The green ribbon is an international symbol for mental health awareness. During pregnancy, apart from morning sickness and tiredness, mood swings, feeling tearful, getting easily irritated are quite common, but once body gets adapted to the higher levels of pregnancy hormones, the symptoms should wear off. But for some women, it will pursue throughout the pregnancy. A calm and stress-free pregnancy is the best gift one can offer to an unborn baby, which can be achieved with good diet, exercise, sleep, hydration, good positive thoughts, and good company. The combination of physical and emotional changes associated with pregnancy may lead to mental health issues such as anxiety, depression, and stress in some pregnancies. Depression and anxiety are the common mental health problems in pregnancy, affecting 10 to 15% of pregnant women. 12% of women experience depression and 13% experiences anxiety at some point, and many women will experience both. Depression is sadness or feeling low, which may be pre-existing before pregnancy, or it may manifest during pregnancy, maybe due to not happy about being pregnant or dealing with lot of stress at work and at home. Anxiety is a fearful feeling, invariably negative feeling and worry. For example, that I won't be a good mother and I can't afford to raise the baby. Stress during pregnancy can manifest as increase in heart rate, palpitations, increase in blood pressure, headache, back pain, tummy upset, teeth grinding, difficulty in concentration, excessive fatigue, eating problems, sleeping problems, etc. Many of these problems could be physiological in pregnancy, in which case the symptoms are milder and temporary, and detailed evaluation is required to differentiate between physiological and pathological. Let's try to understand the effect of mother's mental health on the baby. More recent research studies suggest that as the fetus grows, it is constantly getting messages from its mother, which has an impact on its growth and development. Hence, mother's mental health can affect her baby while she is pregnant. During pregnancy, baby can feel what mother feels and with the same intensity. For example, if mother is crying, baby also feels the same emotion. Mother's emotions affect the emotional state of the unborn baby. Emotionally secure, well-rested, stress-free mother create an emotionally secure, optimally developed baby. This has been illustrated in our mythology as in Bhakta Prahlada, Ashtavakra, Abhimanyu stories. Please note the effect of negative emotions on the baby. Negative emotions can increase the risk of miscarriage. Emerging research shows that maternal depression during pregnancy is a risk factor for low fetal birth weight and premature delivery. Animal studies have shown that babies exposed to more stress hormones while they are in the womb are more likely to have a very active amygdala in the brain, which means that they have high anxiety levels. Research also suggests that babies are indeed affected by parental fights. Chronic exposure to such conflict may affect baby brain development. Most of the studies have shown a significant relation between stress, depression, anxiety during various stages of pregnancy with delayed mental, motor, and behavioral development of the child and delayed infant cognitive development. All the studies observed significant association between stress during pregnancy and undernutrition in infancy. Social behavior of the offspring can also be influenced by the prenatal depression. It's very important to treat mental health issues in pregnancy because it has an impact on baby's growth and development. Most of them are treatable. With right support, most people recover. Those with mental health concerns during pregnancy might not take care of themselves, or they may use drugs and alcohol, which may harm them as well as the little baby. It has been found that education and good health status before pregnancy and obtaining knowledge of prenatal and postnatal care can reduce the risk of women's miscarriage. This is a very important slide depicting what one should do when there is mental health issues during pregnancy. Very, very important slide. Please talk about your feelings to your friend or family member or doctor, counselor or therapist or social worker, which is called talk therapy. Practice breathing exercises or meditation, which will calm your mind like a miracle. Be physically active, which will improve your mood and sleep, as this produces happy and relaxing hormones. Eat regularly, healthy food, and hydrate well. Attend antenatal classes and meet other successful pregnant ladies. Practice mindfulness, which means be in the present moment and not to have imaginary future problems. Sort out your financial worries, list your concerns, and find out the solutions for each problem. Please remember, for every problem, there are multiple solutions. Give priority in solving the problems. Practice every day attitude of gratitude at least for few minutes. This is amazing and brings immense happiness. Be aware of what you are doing and what you are thinking, that is called self-talk or self-analysis. Be expressive, accept people and situation as they are. Be kind to yourself, which brings lot of contentment. Practice forgiveness, which brings lot of peace of mind. Take positive affirmations every day, which brings lot of self-confidence. Listen to soothing music, which relaxes your mind. Find reasons to meet or talk to people with whom you are comfortable, because when you meet loving people, lot of happy hormones are produced. Take medicines prescribed by the doctor regularly, considering the safety of your pregnancy. Let us now list don'ts during pregnancy so as to maintain good mental health. Don't compare with other pregnant women because each one is unique. Don't be afraid to tell about your feelings to healthcare workers or close people. Don't use self-medication in the form of drugs or alcohol. Now, let us try to understand what are the myths about mental health. They include mental health problems don't affect the baby, which is absolutely wrong. All people with mental health problems are violent, which is nonsense. People with mental health problems cannot tolerate the stress of job. Not at all. They can do their job very well. People with mental health problems will never recover. Absolutely wrong. They can recover provided they follow the instructions religiously. Therapy and self-help are waste of time. Not at all. They have a lot of contribution in the recovery. Prevention doesn't work. No, prevention definitely works. Severe form of mental health problems can develop for the first time in pregnancy or after birth. There may be a previous history or the family history of mental health illness. It's very important to have a pre-pregnancy checkup, and if they are on any medication, it has to be discussed with the doctor and then only to plan the pregnancy. Mental health during pregnancy can get affected due to stressful events in life like any death of a close family member or lack of support, upsetting memories about difficulties in their childhood, or due to stoppage of medication. Apart from depression and anxiety, pregnant women may have other mental health issues such as bipolar disorders, post-traumatic stress disorders, panic attacks, obsessive compulsive disorders, and eating disorders. All these conditions need to be meticulously handled with combined care from psychiatry specialist and obstetrician along with support group. Reach out to mental health professionals in the following situations. When you are feeling very low, sad, or down without any specific reason, not able to concentrate on work or feeling very confused, not participating in any activities with friends and family, not able to cope up with daily stress, always worry about things, feeling scared or extreme guilt problems associated with drugs or alcohol, changes in eating habits, mood swings, or any suicidal thoughts. On a lighter note, to all pregnant women, I want to highlight on two things which I encounter commonly in day-to-day practice. Firstly, mental health gets disturbed when too many people give too many suggestions which you are not aware of. In this situation, best is to nod your head for their suggestion without antagonizing, and later you can always cross-check with your medical professional. Internally feel good that there are so many people who are caring for you and your child. Secondly, mental health may get affected when unexpected problems are detected during pregnancy, like high blood pressure, diabetes, small baby, big baby, excess water around the baby, less water around the baby, to name few conditions. In this situation, it is better to follow doctor's advice sincerely with utmost trust and hope and positive thinking. Accept the condition and do your best so that there is no additional stress. Now, it is proven beyond doubt in neuroscience that you can change the structure of your brain with your thoughts, feelings, and actions and create a beautiful life for yourself and hence for your baby. Use your knowledge and intellect to strengthen your emotions, otherwise such knowledge or intellect may not be of much use. Energize yourself and baby with your positive thoughts and vibrations. Thoughts are so powerful. What you think, it will happen. What you feel, you will experience. What you imagine, you can create. So always think, feel, imagine good things and right things and create a good child who is going to be a good citizen for the better world. This is the best gift one can give for their child and for this beautiful world. Thank you very much.